Hello, welcome to Aging Well in America. I'm Anne Marie Gattari, your host. Every day, 6 to 10,000 people turn 65 in the United States. 5.5 million are aged 85 or older, and by the year 2050, that number will grow to 20. 20 million people will be the age of 85 or older. Are we ready? Is America ready? There's so much good work going on around the world, around the country, and right here in our own community. And today we have 3 of those people with us, and they're going to talk about some of that good work. They're from My Doctors In, Dr. Neelam, Karen Adair, and Dr. Menchi. Welcome.
Thank you.
We're so excited to hear about your new community on the east side called My Doctors In. Karen, give us the high level, the 10,000-foot view of My Doctors In. What is it?
Well, My Doctors In is a new assisted living memory care community built with a main street inside the building, which has an atrium in there. So it makes the residents feel like they are outside even though they're inside.
And I've been there. It's very beautiful. It's very bright. You indeed do feel like you're outside. But one of the very exciting and I think interesting facets of it is that it is in fact owned by doctors, 20 of you, which is why the name, correct? So tell us a little bit about the vision, Dr. Neelam.
Well, you know what, I work at hospitals, and one of the things that I notice very clearly is when I make rounds at the hospitals and I see a lot of elderly patients in the hospital, I hardly see anybody visiting them. And I think loneliness is one of the biggest disease in America and in the world, by the way, okay? And then I see, you know, in the hospitals, we see complications of people coming from the various facilities, and I said to myself, thinking about it, there's got to be a better way. There has to be a better way that we can look after our seniors with dignity. And that was the start of the thinking of how we should do something to raise a bar in the whole country, in fact, the whole world. And it's starting right here in Michigan, what we're doing, and how we're transforming their care and the living with assistance rather than assisted living. We're living with assistance.
Living with assistance.
And as well as with the care that we want to provide at such a high level that people will feel that they're living with dignity.
We were speaking earlier before we began, and you talked about those two things. It's about the care and about the living. Talk to us a little bit more about the living, Karen. You started to explain what the atrium and the main street. Dr. Menchi, your participation in this program, as you explained earlier, is really born of your own personal experience. So what are some of the, again, some of the facets that you brought with regard to the living aspect?
My mother is 90 years old. My father, before he passed on, was 92. And as they got older, they were beset by a number of medical problems. Several years ago, my mother had a stroke. And at that point in time, they had moved to Wisconsin to be near my brother, who was helping them. It took about 4 months for my mother to recover, and during that time, my dad got ill as well. They were in an assisted living place in Wisconsin, and the assisted living place did not have 2-bedroom facilities. And as a result, my dad lived in one part of the building and my mother lived in another.
Oh, that's
and they were reaching a point where you know, we had to do something to help them out a little bit more, otherwise we'll continue in that kind of setting. So we found a place here in Michigan where my dad, who was doing better at that time, could help my mother, but my mother needed a lot of care still. So we moved him here to Michigan to a senior housing area with assistance. However, during that time, my father got ill again, and he ended up passing on, and my mother was by herself. She still had a lot of deficits from her stroke, but was able to get along. The place that we chose had a lot of amenities and activities that she was participating in. However, she had another stroke.
Oh, boy.
And it became more difficult for her to participate and be part of the situation. And she was lonely because my father was gone. When we chose this place, it was supposed to be equidistant between 3 siblings, and which was far away from every one of us. So as a result, my mother didn't get to see us that much, and the loneliness got worse. And then as time went on, because of the stroke, she developed vascular dementia and became more difficult for her to handle her own affairs. During that period of time, you know, my mother ended up in the hospital a couple of times. She was unable to really take care of herself there. She's now in another facility, and we're waiting for her to actually join my doctors in.
She'll be one of the first residents, I understand.
She's already the first. She's already the first.
That's
She's the
great.
queen.
She's the queen.
So
She's toured it, has she seen
she has toured it and loved every minute of it, and everybody there has just made her the queen all the way through.
Yeah, that's
So-
wonderful. Getting back to the living experience, what will her day be like? Dr. Neelam, can you tell us what
Well,
will
I mean, I think
Mrs.
first of
Menchi's
all,
day?
everyone will be assessed by a team, our
Okay.
nurses, and then they'll decide whether they should go into the assisted living side or should go to the dementia side. But and then there will be both great experiences for them. It's just that we have to make sure that they're looked after properly and safely.
Correct.
And so the thing is, in terms of the dementia side, I mean, you know, when I've toured other places, unfortunately, a lot of them look like institutions. You know, there's no place for them to walk around, and some of these patients like to walk and walk and walk. So there's nothing for them to do other than just being confined to closed spaces, and we didn't really want that. We want these are people, these are human beings. So we have to make them feel like they're human beings. So we have this whole open concept where, you know, they're living, but then they come out and they're into their shared living rooms with everyone else. I mean, there's common areas. There's so much freedom to walk around different places.
I think we have some photos
Sure.
to show. Before we do that, though, Karen, you were talking about the ratio of staff to resident, and that is another one of the differentiators, if you will, of my doctors. And
Yeah, one of the main focuses that the doctors wanted was the care, of course, and in doing that is we don't want residents waiting for somebody to come and help them and assistance with going down to meals, helping them to the restroom, spending a certain amount of time on a shower. So what we've done is we've cut down on the residents as far as the per ratio per caregiver. So in our memory care, it's 5-to-1. In our assisted living, it's 7 residents to 1 caregiver there.
And in your experience, how does that compare with what other facilities may have?
From what I've been told, it's been approximately 10 to 12 per resident. I'm sorry, 10 to 12 residents per 1 caregiver.
Per one in other facilities.
In other communities,
so
correct.
you're half that.
Correct.
Essentially.
Right. So we don't have the families coming back to us to say, why is it taking so long for somebody to come and help
That's
my
one
mother
of the
when
biggest-
the cord is pulled? We
Yeah.
also do 2-hour checks
Oh,
on a regular basis.
oh, wonderful.
Yeah. In the beginning, we do 1-hour checks,
Great.
and then we kind of get to know them, and then we will do 2-hour checks.
Once you, right.
But
once
if
you
they
get
do
to
need
know
that
them.
assistance with that 1-hour check, there's no difference in price. It's all the same. Everyone's
Great.
treated equally.
Can we look at the photographs that Karen has brought of my doctors in? I'll just ask you to walk us through. Please join in, all of you.
That's our sign.
It's the front of our building. It's our lobby as you walk into our assisted living.
Does the memory care have a different
It does. Memory Care
entrance?
has a different entrance, and that is
and you've
secured.
got photos of that?
I don't have photos
Okay.
of that. We're
Okay.
still in some of the construction phase. So
Got
we're,
it. I'll let you
yeah.
continue.
This is our private dining room where families can have private birthdays and celebrations in there.
Nice, very nice.
Here is our memory care unit, and this is called one of our neighborhoods, in which the concept we have here, there isn't any hallways. As you can see, the white doors, that's actually right to the family's rooms or the residents' rooms. We also have way in the back is a kitchen. So we have a kitchen.
That's
full-
that orange,
the orange
wall,
Mhm.
right?
That kitchen area is for the family or the resident to come and think that they're actually cooking. It's not. It's a non-working kitchen.
Okay.
But if the resident wants to feel like they were a cook or they enjoyed cooking,
Right.
they can still go and do those activities.
So there's, right, as you say, an activity. Yeah.
This is their dining room. We have a beautiful fireplace there right in the dining room, and it overlooks an outside window, and so they have the sunlight coming in.
Patio.
Over a patio.
Here's another view of the fireplace, and they can come and sit there. This is our lecture room. This is one of the unique things that we have at My Doctor's Inn. And our lecture room is also our theater room, which is called Casablanca. But right now, it's just staged for a lecture. But we also have large couches that the seniors can come in and watch a movie when we have a movie night there.
Now, if we could stay on the lecture facet for a moment. Dr. Neelam, you had mentioned that you plan to do training for your staff. Is this where this will happen?
I mean, the training will obviously occur at different places,
oh,
but we want everyone to be CPR certified. We want there to be continuing education for our nurses, our caregivers, so that they're up on medications and safety. Because to me, safety is the number one concern. If I put my own parents somewhere, I want safety to be their concern. So I think with that in mind, you look at what we can do to keep a safe environment for them and a happy environment for them, and a happy environment where they can grow. See, I believe that wellness comes from three different things. One is nutrition, one is exercise, and the third one is mental well-being. So we have to provide that. You have to think about all those things, and then the residents will feel that they're part of a community where they're growing, and they're just not left to, just do nothing, I suppose,
Yep, exactly, yeah.
One other thing I wanted to add on our lecture room is that our lecture room is not just for our families and our residents. We are going to bring people coming in, outsiders to come in to get educated on chronic diseases. And we're going to invite the doctors that are on staff to come in and speak about the chronic diseases so they can get educated on that particular disease. So that's
great.
something that's going to be a little different.
When you talk about the doctors, there are, as we mentioned, 20 physicians are part of this group and involved. Dr. Menchi, exactly what will be the involvement? How often will a typical resident see one of your doctors?
Well, I think we're going to be giving lectures on a fairly regular basis. We haven't really quite set up the time frame of that, but probably on a monthly basis, several lectures will occur.
And this will be for residents and
For residents and
families?
probably for family. We also plan on doing it for the general population as well, so they have a chance to be introduced to our area and maybe learn some things. We plan on by not only giving the lectures to educate, but with our own people, hopefully they'll educate us. And
I'm sure.
hopefully we'll be able to learn some things with them on how to improve this for the future. With the baby boomers getting older, anything that we can learn and apply the next time if we do something like this again is nothing but gravy.
Yeah. We have more photos here. Oh, here's what is this? Is that beautiful atrium area?
Yes,
That's so
this is our main street. This is kind of a premature picture, but we're going to have trees in there. We have, I'm not sure if there's a picture of our fountain that's in there.
Okay.
We're going to have some outside patio furniture that
And
they
those
can come.
little stores,
And
those
storefronts
storefronts,
are going
those
to
are
have
operating?
Yep, those are actually, there's our fountain there. And they're going to have, we have a bistro. So when families come in after hours and they're hungry, they can still get a bite to eat. They can bring their family down there. We have a kids zone, which is called Play It. And that's for the kids because we want to really encourage families to bring their grandchildren in and to, so they can come and visit grandma and grandpa, and it's not going to be institutional. So we want that, we have that. We also have a library and a computer room, an activities room, a hair salon. So it really gives you the feel once you're there. A lot of people when they're visiting, they feel like they stop and they wait a minute and they pause and they're like, are we outside?
Right.
And it gives them that sense of feeling that they're outside.
Yeah. Very, very
Well, I think one of the
attractive.
things is that when I go there and I visit and I see this outside people coming in there, and these are either accountants or lawyers, and they say, well, can I move in here?
Yeah.
It's really funny because they feel really involved with that concept. And like I said, the other thing I was going to mention to add to what Karen said about the kids is because remember I started out by saying that I don't see in the hospital elderly patients that have no family members, but I've also seen the times when kids come there and that you can see the eyes of the patients light up, and I don't, when I visited a bunch of these communities before we made this one out here, I never saw a kids zone anywhere, okay? And I think I make a prediction today. I bet you in 10 to 20 years from now, you'll see a kid zone in every single assisted living in North America, at least the new ones that are coming up. Because the reason is you want that interaction between grandparents and grandkids.
I can even see schools getting involved and making it part of their school day, right? With kids needing to do so much volunteer work. I could see teachers bringing a class on a regular basis. I think that would be a fabulous idea.
Yeah, I think.
What about pets? Can residents?
In assisted living, we are allowing pets.
Oh, good.
And so,
was
yes,
hoping
one
you would
cat
say that.
and one dog, and it has to be, I think, under 35 pounds or 30 pounds.
All right. My
Yeah.
dog wouldn't qualify.
Yeah, but unfortunately in memory care we don't have that because it is a secured environment.
You know
so-
what, Karen, I was going to add something to there. I think we are going to have people who specialize in pets, because there is, I do
Pet
believe in
therapy.
pet therapy is very important.
Yeah.
And I see in the hospitals, dogs, you know, sometimes
Yes.
they bring these
Yes.
into the patients, and I see the interaction between the patients in the hospitals, and we are going to have that in the memory care, but maybe not as a personal thing, but as somebody who specializes in pets, as a pet therapy, because really I do believe in a lot of non-medicinal therapies for our dementia patients as well as assisted living patients, because I think as a society we're overdrugged. I really believe that, you know.
I'm
And
so
then-
glad to hear you say that. I
You know,
wanted
because-
to ask you more about.
No, because I personally feel so often what happens is, and I see this in my practice every day, patient has a symptom, they get put on drug. Then they go to another doctor, they get another drug. And then pretty soon then you have all these side effects of these drugs, and they're coming to see me because they're having side effects. Or they're having, but they never address the underlying problem. The underlying problem may have been anxiety. And then so I really believe that there are so much things you can do for anxiety and depression without resorting to pills. And I think my goal is to use in the future as well a lot of these non-medicinal therapies. I mean, it could be music therapy, it could be art therapy, it could be puzzles and something that stimulates the mind, stimulates their whole internal endorphins and good hormones that you don't need pills, okay? And I'm so tired of just doctors out there just writing pills after pills, and I sometimes see patients with 20 pills and 30 pills, and I'm saying, what for? I mean,
Yeah, at some point, as you said, you don't even know what the underlying issue is or what's causing what. That makes me think of, you mentioned an assessment when someone first moves in. Can you describe, Dr. Menchi, what is the full assessment that a new resident would go through?
Well, I think basically the assessments are going to try to figure out what their cognitive skills are, you know, whether it's able to handle concrete information, puzzles, excuse me, or how they're able to handle little problem-solving skills, besides the assessment for physical abilities. When you do an assessment, you're trying to figure out where these individuals should actually be getting their care. You know, is it from an area where they're going to have more intervention, or one that they're not? My mother, excuse me, my mother had to be interviewed and assessed to try to figure out where her best place would be. In the memory care area, we do have a number of different levels of assessment, of placement, and she was placed in the first level. So she'll be in with individuals who may have the same kind of cognitive skills and interactions. Those who have more difficulties would be placed in another group where they would be more closely watched. This actually is a good thing because my mother, where she's at right now, doesn't really have that kind of specialization or where they are able to separate people who may not be able to interact as well as she does. And it's been somewhat of a distress for her.
Will you also be able to assess the meds that they are on? Will that be part of the assessment?
Well, it'll be part of
pharmacists
the
be
assessment,
involved?
but I think it's also still up to the physician that is going to be watching my mother or any of the residents that
Right.
are there. We won't have oversight for that part of it unless they're our own patients.
Right, okay. And Karen, you did mention, so with 20 doctors, residents or potential residents may think that if they're coming in, they have to leave the doctor they're currently seeing and sign on with a new one, but that's not the case, I
That is not
understand.
the case. One of the advantages of coming to My Doctor's Inn is next door to the building is our owners, some of our owners that work right out of the office. So if you establish that, that work with that doctor, or you start seeing that doctor, then what's nice about that is that it will cut down on hospital visits. For instance, you have a cold coming on, or you're not feeling well, or one of your symptoms, you're having issues with diabetes. We can call the doctor over during regular business hours, and he can come and see that person versus immediately sending them off to the hospital because the nurse it's out of the nurse's control. Or the other nice thing is the nurse can just call the doctor to say, you know, what should I do? This is kind of an emergency situation, I'm not sure, so tell me what to do, and either, you know, they can just get some information over the phone or come over to see the patient. So that's one of the advantages of being at staying at My Doctor's Inn.
I can imagine how that will, in fact, reduce the need to go to the hospital. Are you all affiliated with one hospital?
Yeah, I'm on staff at 2 hospitals, at St. John, Macomb, and also Troy Beaumont.
Okay, okay.
Same here.
Is that true for all of your
No.
all of your doctors?
Some of the, I think some doctors are only Beaumont, Troy, and some of them are only St. John, Macomb, and so, but in that area.
And other hospitals
But
as well.
the point is that it really doesn't matter. I mean, residents can come from anywhere. They can be affiliated with any doctor in any hospital.
Well, the hospitals that are close by are St. John Macomb, that's
Sure.
the closest, and then Troy Beaumont as well, and Henry Ford Macomb is on the third one.
We didn't even talk about where it is. Where is My Doctor's Inn?
We're at Metropolitan Parkway in Van Dyke, and the easiest way to
Okay.
say that is behind Myers.
Behind Myers, okay.
Yes.
So
we're in Sterling Heights.
16 in Van Dyke.
16 in Van Dyke.
In Sterling Heights.
Yep.
And how big is it? How many residents? How many beds, as they
We
say?
have 90 rooms, 35 memory care, and what's the difference here? the rest assisted living. But we do have
Good.
8 two-bedrooms. So
82.
8 two-bedrooms.
Oh, 8 two-bedrooms. So,
which has been
right, which is
a
important.
very big interest. A lot of people that
Yes.
are calling, they want to know if we have 2 bedrooms. So
Right, right.
that's in
And,
assisted living versus
and-
independent living.
Great. I do have to ask about the cost to move in.
We're very competitive. When it comes to memory care, we are, I would say, a little less than most memory care, but in the assisted living side, we're very competitive when it comes to the pricing.
Terrific. And how good is the food?
Well, listen, I can tell you right now, I work at St. John Macomb Hospital, and I've been eating the food out there, and I thought it was, terrible. I'm sorry to say that on air, but and so what I did was I took the chef to Henry Ford West Bloomfield. Now the chef and the whole heads of departments. Then they took
From
me
the hospital or from your
from my own facility.
Okay, okay.
Because I said we have to improve the quality of
Yes.
nutrition.
Yes.
I mean, nutrition is 1/3 of the remember I said about nutrition, exercise, and mental well-being. So I took them to Henry Ford West Bloomfield. I said, listen, they're all having, organic or fresh-made food and things like that. We need to improve our quality of nutrition. And then they took me to Providence Park, Norway, where, there's kind of sister hospital where, again, the food is. So we're improving the quality of nutrition at St. John Macomb Hospital dramatically. And if you ask the doctors today versus a year ago, they notice a big change. So because I'm involved in this out here, nutrition is very important to me. Because when I go to restaurants, a lot of times I like to eat mostly vegetarian food because vegetarian, maybe a little fish, but is more healthier for you in general, okay? Lots of studies in a lot of different things, but I understand there are other people that eat meat and everything, this is fine, but you've got to provide healthier choices for people that want to eat healthy food, okay? When you go to a lot of restaurants, they have 3,000 calories, and you don't even know what you ate, okay?
Right.
So I have already talked to the chef
Okay.
at our place that we want to have choices. People, if they want to eat junk, that's fine, they can eat junk if they want. That we're not going to, at a stage in their life, I don't want to force them to. But if the people want to eat healthier, we have to have healthier choices, proper nutrition for people that want to eat healthy. So nutrition is very important to me, so you're going to see a change.
And also, of course, the quality. I mean,
Yes.
nutrition is one thing. You can get nutrition and it doesn't always taste so wonderful, but it sounds like you've made stuck a stake in the ground and said,
I'm doing that at the St. John right now.
Yeah, yeah.
And people have noticed a change in the nutrition there.
thanks to Dr. Neelam.
Well,
And that's one of the nice things for working for my doctors is the doctors are involved with their input, not just with the food, but from the care, the design of the building, everything. When I'm walking and doing tours, I'm explaining to them, this doctor had this influence, this doctor had this influence. So it's very nice that I can share those stories with them, and they're there involved in it.
So if I'm a resident there, how often will I see one of your doctors walking
You'll see
around?
me a lot because my mom's going to be
Because
there.
your mom's going to be there. That
I'll
is
know
so
most of
nice.
them. Actually, a couple of my patients are actually going there.
Yes.
Is that right?
So that will be interesting.
Yeah.
So
That's fabulous. We've got a few minutes left. What else would you like to
Well, you know, what I was going to
tell
tell
us
you was
about
that
we
since-
didn't?
well, one of the things I was to tell you was that since we're just starting this, and I'm learning a lot myself because I didn't know as much about it. But one of the things I learned is that not every facility out there is licensed. I mean, I didn't know it's like somebody's board certified physician versus non-board certified physician. There's sometimes there's a little difference between the two, right? So if it doesn't matter, people shouldn't necessarily have to come to us. I mean, but they should ask the right question for their own family. I mean, is it licensed? Because licensing requirements makes it much more different because people have to be screened for criminal backgrounds and things like that. Okay, and also the house is constructed because like ours is steel constructed. So if there's ever a fire, people tell you to stay in your room. Whereas if something's wood constructed, the
You
whole
gotta
thing
leave the building.
well, you got to leave the building quickly, and with seniors, it's hard for them to move. So you got to ask things like that, okay? About how's the air quality? I mean, because you don't want to have polluted kind of air circulated in the building, and so we have made the standards so high in our facility, which is what is important. But they should ask these questions to their own, their facilities actually.
These are really good, just general questions when people are shopping for the right solution for their loved ones. So, well, we've believe it or not, we have come to the end of another great 30 minutes. I wish you all the very, very best of luck. It's a gorgeous facility. I encourage our viewers to go online and look at your facility. Call Karen for a tour.
Thank you for having us.
We'll look forward to having you back in a year or so.
Well, like I
and see
said,
how you're
we
doing.
want the seniors to live with dignity, okay? Because I mean, we're all going to be seniors someday, and
That's
so
right.
we
Very
have
soon.
to, and we have to make sure that we have raised the bar for
That's
the
right.
country, and I think the bar will be raised.
Great,
So.
wonderful. God bless you all.
Thank you.
Thank you.
Thank you again for joining us for another edition of Aging Well in America. Please send us your ideas to right here at the Grosse Pointe War Memorial for future shows.